and welcome to Unit 5, where we are going to talk about bones. Let's start off. Obviously, we are going to have these videos will help with additional information and understanding. Bones is not just the bones, but we also talk about joints here as well, so we do have an additional information video for the joints. But we're going to actually start off with the functions of the skeletal system. So when we think of the skeletal system, you hopefully think of the fact that they keep you upright, and you possibly think about the fact that they are a mineral reservoir. For instance, they store calcium and other minerals. Depending on classes you've taken in the past, you may think of them as also being involved with blood formation, something we will talk about in passing. We'll talk about it in more detail with the cardiovascular system. But what you may not think of is that they also provide protection. Your skull protects your brain, your sternum and rib cage protects your heart, your pelvis helps protect your bladder and internal reproductive organs. Far more critical for females with her ovaries being located inside. However, it also acts as a cradle for a fetus if you become pregnant. Other things you may not think of, bones are involved in movement. If your bones are not there and cannot withstand the force of a muscle contraction, the limb or structure in question are not moving. Muscles have to pull on bones in order to get you to walk, stand, lift, whatever you're doing. Another thing you may not think of, bones are involved in pH balance, and they're going to be involved in the detoxification process. We will talk about these in passing. Hematopoiesis is what we refer to as the formation of blood that is going to occur in bone marrow. So like I said, we will touch on that. For those of you who are recalling your med term, hemato is blood, poiesis is formation. Calcium and phosphate are both stored in the bone of your bones, the actual hard outer shell. Calcium hydroxide, CaOH2, is a compound that can neutralize acids if the blood becomes too acidic. And unfortunately, some heavy toxic metals are sequestered in the bone. This is to keep them out of the bloodstream, out of the other tissues, and away. This is actually a protective mechanism. However, in the long term, it comes back to bite you in the butt. Heavy toxic metals that are sequestered in bone can lead to cancer over time if they do not get removed. Now, how would you get them removed? Depends on the heavy metal, but that would be the liver. So if you are temporarily exposed, you have brief exposure, and then you go back to not being exposed, the liver would be able to, for many heavy metals, take care of it over time. You would excrete it in your waste. However, if you have constant chronic exposure, that's never going to leave, and that sequestering is going to build up.